80% more likely than white people to have diabetes. That can put you at higher risk for severe complications from COVID-19. We have a shorter life expectancy than whites to begin with. We're now seeing COVID-19 disproportionately affect African Americans. Type 2 diabetes is a condition that really can affect your whole body in many different ways. Everything from your brain, your eyes, your heart, to your extremities, your kidney, etc. It is one of these conditions that does put you at higher risk for having severe COVID-19 complications. There's many reasons why this might be the case with diabetics. We certainly know that people with controlled underlying illnesses may do better than those who don't have controlled illness. So we certainly want people's diabetes to be under control. When we talk about African Americans, in terms of diabetes, what we've seen then is this almost has been compounded when we get into the area of COVID-19. So while blacks may make up a small percentage of the population in certain cities and towns throughout the country, we are often making up a large percentage of those who are becoming severely ill with COVID-19 or dying from complications of COVID-19. Racial health disparities is something that's not new. I often think about it as sort of being like an iceberg. The top of the iceberg I think of is the stuff above the water. And what do we see? We see African Americans have higher rates of certain underlying medical conditions that put all people at risk for severe COVID-19 complications. But the iceberg part really comes into what's underneath the water, that big chunk of iceberg that you can't see. African Americans are more likely to not be able to work from home during this pandemic. We're more likely to be essential workers, more likely to have to take public transportation. We're more likely to be underinsured, maybe not have health insurance. Actually, we're statistically more likely to live further away from grocery stores as well as healthcare facilities. COVID-19 is really shining a light on these health disparities. They're bringing them back to the forefront, which is important. We need to always be working to make sure that all communities in our country have access to healthcare. We're becoming empowered even more so to take charge of our health, which is really crucial in what we need to do now and really all the time. So things that people can do to really sort of stay on top of their diabetes is definitely regular doctor's office visits. Many doctors are doing telemedicine or telehealth. Keeping a healthy diet and exercising is very important as well. We know that is a mainstay and a key to controlling and helping to control type 2 diabetes. This is not necessarily a wake-up call, but it's certainly a reminder to us to look at what risk factors we may have so that we can stay as safe as possible.